Hello, my name is Frans Bauer and I'd like to focus this web lecture on the major medical psychology offered by Tilburg University and on the associations between diabetes and depression. Tilburg University is among the 2% best universities in the world, according to 3 well-known university rankings. And what's also interesting for you to know is that Tilburg hosts CORE, the Center of Research on Psychological and Somatic Diseases. And within CORE, I'm a coordinator of the diabetes research as a professor of medical psychology. So in this video lecture, I'd like to focus on the major medical psychology and then tell you more about diabetes mellitus and about the associations between depression and diabetes, which are actually bidirectional. Research has shown that depression in people with diabetes has an impact on health outcomes, but the mechanisms that link both diseases are quite unclear. So there's much more research needed in that area. I'd like to end my web talk with some practical tools for the medical psychologists. So I'd like to share with you good information about the treatment options that are currently available. The major medical psychology that's offered by Tilburg University consists of additional courses. So for example, there's one course focusing on stress and health, a second course on sexuology, a course on clinical psychology and medicine, and of course psychological assessment in medical care settings. And the bachelor thesis, medical psychology, is also part of the major in medical psychology. When you choose for the major in medical psychology, this is actually an excellent preparation for the 2-year master medical psychology that's offered by Tilburg University. And actually, Tilburg University is the only university worldwide that offers a 2 years master in medical psychology. So that's something to keep in mind. This is some information coming from the RIVM, a well-known institute in the Netherlands, about the most common chronic diseases in the Netherlands. So what you can see, for example, is that diabetes mellitus is among the most common chronic diseases. 1 million people in the Netherlands suffer from this disease. But other common diseases include neck and back pain, mood disorders, coronary heart diseases, asthma, cancer, and COPD. What is important to remember is that psychological and behavioral factors play an important role in the development of several somatic diseases like cardiovascular disease or diabetes mellitus. And at the same time, having one or more chronic diseases can seriously impair the psychological well-being of people and their family members. And it's also known that psychological factors and behavioral factors can impair self-management behaviors and, of course, the course of the disease. There are several types of diabetes, and the most common types include type 1 diabetes. Approximately 10% of the people with diabetes have type 1 diabetes, and type 2 diabetes. In people with type 1 diabetes, the body's immune system has attacked and inactivated the beta cells, which are located in the pancreas. And as a result of this, people come in the hyperglycemic state and they need insulin injections or insulin pump therapy in order to survive. And an important task they have is to keep these blood glucose levels within the normal range. People with type 2 diabetes, they have beta cells that are not capable enough to produce sufficient amounts of insulin, and the cells of their body have become insulin resistant. And as a result of this, they need oral medication or insulin therapy in order to achieve good glycemic control. Achieving and maintaining good glycemic control is very important. Why? Because people with diabetes are at increased risk to develop diabetic complications. For example, neuropathic pain or loss of sensations, kidney disease, or cardiovascular diseases and retinopathy are well-known and common complications of people with diabetes. Another complication of diabetes is depression. So having type 1 or type 2 diabetes doubles the odds of depression. And depression is a very severe mental disorder with severe symptoms like depressed mood, decreased interest or a lack of pleasure in things that are normally pleasurable, sleep disturbances, changes in activity, severe fatigue, feelings of guilt, loss of concentration, and thoughts about death or even suicide. So this is a really severe disorder. And we know from lots of studies that having diabetes doubles the odds of depression. So on the left side of this slide you can see, for example, that 9% of the people with diabetes suffer from major depressive disorder, compared to 5% of the non-diabetic controls in the studies that have used a diagnostic interview to diagnose depression. If you look at the studies that have used self-report questionnaires to measure depression, approximately 26% of the people with diabetes had elevated depression scores compared to 14% of the non-diabetic controls. And on top of this slide you can see that in both types of studies the odds were doubled. In one of our studies we compared people with type 2 diabetes only with those who had no chronic disease at all. And if we did that, we found no difference in depression risk. If we compared those with type 2 diabetes and complications of the disease with those with no chronic disease at all, we found a doubled risk of having depression. So this suggests actually that the burden of the complications of the disease play a very important role. We also found in one of our meta-analyses that having type 2 diabetes is associated with a 24% higher risk for developing depression in the future. So having type 2 diabetes is an important risk factor for depression in the future. It makes people more vulnerable for depression. We also found that the course of depression is often quite chronic. So on this slide you can see that based on post-op data we found that 66% of those who had a high depression score at baseline of the study had a high depression score in 2007 or 2008, a few years later after the baseline. And we also found that the very best predictor of depression in the future was a history of depression. On this slide you can see a picture of Thomas Willis, a famous English physician who lived in the 17th century, and he observed that diabetes often occurred among people who had experienced significant life stresses or periods of sadness or melancholy. So from his point of view, depression was a risk factor for developing type 2 diabetes. And many years later we conducted a meta-analysis together with Mirjam Knoll from Utrecht University, which actually showed that Willis was right. People with depression are at increased risk to develop type 2 diabetes. So we could use data of 9 longitudinal studies showing that the risk of depressed patients was actually 37% higher compared to non-depressed people of developing type 2 diabetes. In this slide you can see that if people have type 2 diabetes and depression, that they are at increased risk to die earlier. So the gray line consists of the group of people who don't have diabetes and who don't have depression. And in this group the survival rates are the highest. It's a bit lower in the depressed group and even more lower in the dotted group, which consists of people with diabetes. And the mortality rates are the highest in the group of people who had diabetes and depression. So having diabetes and depression is a worrying combination. This is yet another meta-analysis conducted by Fleur van Doorn, which clearly illustrates that if people have both diabetes and depression, the odds of dying earlier is 46% higher. This brings us to the question, why do people with depression and diabetes die earlier? Well, it's most likely because depression impairs their self-care behaviors. So Gonzalez showed that the diet was less optimal in depressed patients. Medication adherence was much more optimal in depressed patients. They exercised less and they monitored their glucose also much less. So this is a very likely mechanism linking depression with poor health outcomes. But there are probably also biological mechanisms. So these mechanisms are still a black box. And it's likely that increased smoking behaviors, for example, play a role, but also stress hormones and inflammatory markers and higher levels of oxidative stress could also play a role in linking depression with poor health outcomes. And this is really also an area of medical psychologists. But this brings us to a very practical questions. What can medical psychologists do to help people with diabetes and depression? Well, CBT is, for example, a very effective intervention. This is a study by Pat Lussman conducted a couple of years ago in the United States, showing that more than 80% of the people who had diabetes and depression, who received cognitive behavioral therapy, had a remission of depression. So they got rid of the depression compared to 30% of the people in the control group. And in CBT, people learn to think differently in a more rational way, and they also learn to change their life and seek social support, for example, and exercise. So this is a very effective intervention that can help people with diabetes and depression. And nowadays, it's also possible to offer CBT online. So together with the VU University Amsterdam, we tested an online treatment for depression in people with diabetes called diabetergestemd.nl. And we found that this intervention is also very effective. It's a very efficient way of offering CBT. So the coaches can support people with depression online. People have to do some homework at home. And we also found in this study that the intervention decreased diabetes-specific emotional distress. So they had less worries about hypoglycemic events, less worries about complications after they had received CBT. We can also treat depression using mindfulness-based techniques, and these techniques do not try to change the thoughts people have, but learn people to observe their thoughts and focus their concentration, for example, on the food they eat or the activities they do. So it's quite a different intervention compared to CBT, but we also found that this is an effective way of helping people with depression and diabetes. So all in all, I'd like to conclude that depression is a common comorbid problem in people with diabetes, affecting 10 to 30% of the people. Depression is a risk factor for type 2 diabetes and its complications. And medical psychologists can effectively treat depression in people with diabetes using evidence-based treatments such as online CBT or mindfulness. But it's currently unclear whether successful treatment of depression is associated with lower mortality rates. So this is typically something to test in future studies. Thank you very much for your attention and have a good day.